Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. Here at Gold, the preparations for the Gold Perinatal Online Conference of 2019 are in full swing. And I am very pleased to announce that we have one of our speakers here with me today. Her name is Sinéad Dufour. Welcome, Sinéad.
Hi, Kristen.
Oh, it's so lovely to have you here today.
Yeah, I'm excited to be able to speak to the listeners a little bit about what I've been up to and what my talk is going to be about.
Oh, wonderful. And we can't wait for it. So yeah, let's just jump right into it. So tell our listeners, number one, where are you located in the world? And then tell us a little bit about yourself and your professional background.
Yeah, absolutely. So I'm located in Canada in a province called Ontario. So I'm actually located in a city called Oakville. So that's pretty close to Toronto. And I am sort of, I guess, what you would call an academic clinician. So I share my time between the maternity care center that I have a practice in. I'm a pelvic health physiotherapist. But then when I'm not busy at my practice, which is called the womb, the world of my baby, I'm busy at McMaster University teaching and conducting research in the School of Rehabilitation Science and in the School of Medicine.
That's wonderful. Thank you so much for sharing this. You represent the best of both worlds, Sinéad. You are the researcher on one side and also you're out working in practice in your own practice there. That's fantastic.
Yeah, it is nice to have both those sides, and I do think that allows me to, the research and the clinical piece really informs my teaching and then vice versa. But I would also say, too, that I'm the mother of twins, and really it was my own personal experience that sort of moved me into this place of perinatal care. My PhD and my doctoral and postdoctoral work actually is in primary health care and system care redesign. And so really my interest and now my sort of developing expertise in this area in the last sort of 7 or 8 years is actually from my own personal experience navigating the whole sort of world of perinatal care myself and seeing that there's lots of work to be done there.
That's fantastic. Well, it's wonderful that you're sharing your personal journey there with having the twins and how that propelled you forward to be where you are today in your practice and in your research. I am absolutely thrilled that you're presenting with us this year on, pushing to prevent stress urinary incontinence. This is such an important topic, and I must tell you, I'm a midwife, and I was recently introduced maybe a year ago to a physical therapist who are also specialized in pelvic floor issues, and my eyes were opened big time. I had, as a midwife, I know about the pelvic floor muscles and such, but I have learned so much from this wonderful physician, and you are here with us. You're presenting on this topic too. It is amazing what we will learn from you. I can't even wait, because we have learned that the pelvic floor muscles are so important, and we can do so much to prevent urinary stress incontinence. However, many people don't know about this yet. It feels like it is this forgotten child of care. Many women have babies and they are told, well, if you sneeze, you will probably soil yourself a little, and this is the new normal. Get used to it. Use a pad, right? And then we have this whole area of surgical interventions, or where women have surgery to get things, so to speak, fixed afterwards. But there is a whole world that we can explore that many people don't know about. And so I'm so excited to have you here, and you will be presenting on this topic. So tell us a little bit about this.
Yeah, so actually it's, I find I'm actually quite lucky in my practice that, I have women coming to me when they're pregnant to kind of prepare to birth and to be really proactive. But this certainly isn't the norm where most sort of pelvic health physios are concerned. So it still is very much our skill set, and the principles we use to care for women are still very much used after the fact. Women have an injured pelvic floor from birth, and then after the fact, they go to a pelvic health physiotherapist for rehabilitation. And while that is great, and certainly that's become more popular in Ontario where I am, pelvic health physiotherapy has really only been recognized in my province since 2012. So that's a great step forward, but I would argue there is so much we can do upstream, so we're not needing that degree of rehabilitation on the back end. And, the interesting thing is, if we really just take a deep dive into the literature and the clinical practice guidelines, a lot of the things that, we should be doing are things that will also protect the pelvic floor. And, we have a bit of an issue that this science just isn't mobilized very well. So it's one of my favorite topics to talk about prevention and health promotion on the front end. So yeah, I'm really excited to be speaking to all the listeners about this very important topic that has relevance not just for physiotherapists, that has really important relevance for any single person interfacing with women through the perinatal care period. This information will be really, really useful.
Wonderful. So walk us through a little bit without giving too much away. What can we look forward to?
So what you can look forward to this presentation, of course, I am an academic clinician, and I do work at McMaster University, which is really sort of the home of evidence-based practice. So you will find that my presentation is very, very evidence-based, and I will be taking listeners through sort of, what the science says in terms of injury for the pelvic floor, what are factors that we can mitigate, what do the clinical practice guidelines say, and really looking at how all of us in the relative disciplines that we work in can be bridging this gap to kind of improve outcomes for women.
Absolutely wonderful. And last question here before I let you go. What are you hoping our delegates will take away from it after listening to you? What is a little nugget of wisdom here for us?
Well, I hope one thing that delegates take away is to kind of see that a lot of the best practices around birth actually have really important implications for the pelvic floor also. And I think it's sometimes the very same practices that we should all be really pushing for and advocating for have huge implications for improved pelvic health also, although many people haven't thought about it that way. So hopefully it's just another motivator to be all of us advocating kind of for the same thing for mothers and babies. I also hope, too, that, through people becoming a little bit familiar with just this whole topic of pelvic health through the perinatal care period, and maybe becoming a little bit more familiar about me, and you can kind of tune in to look me up at the womb, the world of my baby, but get tuned in a little bit to other aspects of health through that period that are really, really important. Another area is pregnancy-related pelvic girdle pain. So that's another issue that can be a really, really big issue for women, for a rather high proportion of women actually. And it's something that I have quite a bit of expertise in, and I'm doing a lot of research in. And interestingly enough, with that condition, we're starting to see that that's an issue that really has very little to do with biomechanics of the pelvis. And that's kind of traditionally how we viewed this issue. And so, I would really hope that delegates actually just get some insight into other aspects of improved health and perinatal care, even through getting to know me a little bit better.
Wonderful. Thank you so much, Dr. Sinéad Dufour, for sitting down here with me and talking about your background and about the exciting presentation you will be giving here with us in October.
Great. Thanks, Kristen. It's a pleasure.
And to our listeners now, the presentation Pushing to Prevent Stress, Urinary Incontinence will be live on October 7th. And there will be many other wonderful presentations in this conference series. There will be over 14 hours of education. So please check it out. Go to our website at goldperinatal.com. Thank you, everyone, for listening. Bye-bye.